correct. Oh my God. Okay, determined.
Yes.
Okay.
So we're ready.
Okay, so the correct answer is
Blockage of the inward rectifier potassium channel pores by cytosolic magnesium ion or cationic polyamines.
Since the
wow.
second question cannot decide who will be the next finalist, so we would like to have the MCQ score for us, please.
Oh, okay, and we're going to announce the last team that will go through to the hidden clue with us.
I'll try my best to not do a Steve Harvey here. Anyway, the team that will be in the final round is CU1.
Okay, congratulations to CU1. Okay, so please give a big round of applause for CU2 who made it to the final with us.
Yes, thank you very much. You did your very best.
Okay, and for the other teams, we're going to start the hidden clues right away.
Yes, let's not waste any more time then. So, how do we play the game Hidden Clues?
Well, actually, for hidden clues, it's like a kind of hint and clues.
Yes, and they will not be revealed all at once. They have to slowly be unraveled, slowly one by one.
Exactly, okay. So again, we actually have the video provided about rules and regulations for the hidden clues.
Yes, so if you would like to adjust your seats and face forward, that would be great for the people on stage. That would be nice.
Exactly, okay. And if it's inconvenience, you guys can find your comfort place anyway.
Yep.
Okay, so I wish you all enjoy with the rules video.
Hidden clues. One team will be eliminated, and the 3 remaining teams will continue on to the next game. There will be 4 questions with 5 clues for each question. When the game starts, the screen will show the first question with its first clue. The hosts will give a signal to answer the question. To answer, the team which can hit the button first will have the chance to say the answer to the question within 10 seconds. If the answer is wrong, all teams, including the same team that has just answered incorrectly, can continue to challenge by hitting the button after a signal from the host. A team will not be allowed to answer after answering incorrectly twice for a question. They will only be allowed to answer again for subsequent questions. In case no button is hit within 15 seconds, the next clue will be revealed until a team is able to answer the question correctly or all the clues have been revealed. A team immediately qualifies if they answer a question correctly. The game ends when 3 teams are able to answer correctly. If less than 3 teams qualify after all 4 questions have been done, a sudden death round will be played by the remaining teams. The sudden death in this round is a team challenge. The same rules still apply as previously mentioned. When the number of qualifying teams has reached the maximum, all the remaining teams will be eliminated.
Allow me to explain once again. So at the start of every question, there will be the full question and the first clue. And on my signal, you will have 15 seconds to press the button if you wish to give an answer. From then on, I will give you 10 seconds to say out your answer. If you manage to answer correctly, then you will immediately qualify for the final game. However, if the answer is wrong, then all teams will have another chance to press the button if they wish to give another answer. And if the same answer is wrong, or no team has pressed the button, then the next clue will be revealed. And this will go on until a team manages to answer the question, or all clues have been revealed and no team is able to answer.
Okay, so before we're going to begin any further, for the contestants, I suggest you to stand up because it's easier to press the button, okay?
That's right.
And IMC man, please help our contestant manage about the chairs and other stuff up there.
Yes. And one more thing is that for every question, every team is only allowed to answer wrongly twice. So if you answer twice and you still cannot manage to get the answer correctly, then you will lose the right to answer for that question, and your rights will only be returned for the next question.
That's right. And according to what TK said, we have the cross signal. IMC man, can you show the cross for us?
Yes.
Okay. This will sit in front of the team name to
Yeah.
indicate that that team is not allowed to answer in that question anymore.
Yes, so for this game, we have a lot of equipment, right, Namfa?
That's right. So we just have to do a bit with the devices check.
Mm-hmm.
Okay, so team UPCM 2019, can you please press the button? Okay, and microphone check.
Mic test. Hello.
Oh,
Great.
perfect. So, MEDTU, can you do a button check for us?
A button check.
The button is right in front of the desk.
Yes.
Yep. And
Great.
please say something into the microphone.
Hello.
Great, okay. And for CU1, can you please button check? Perfect, and microphone?
Test. Hello.
Good job.
And last but not least, NMU1, the button. And your microphone.
Hi.
Yes.
Oh, so
Magnificent.
cute. Okay, but before that, guys, with TK signal, try to challenge pressing the button all together.
Right, so a very important warning is that do not do anything until I give a signal.
Okay, so waiting for TK signal and try to press the button.
So do we have the demonstration question for this game?
Yes, we are.
Yes, we do.
But before that, try the button together first.
Yes.
So at the count of 3, 2, 1, press the button. No. I
Right.
just try to let you guys test whether
This is
the
a-
button is work or not.
Yes, this is a test where, when the two teams press the button at the same time, the signals will not interfere with one another. So only one button will be light up. So if we would like to help us, all the teams, please get ready to press the button again once more.
Okay, so once again, at the count of 3, 2, 1, press. Ah,
Okay,
great.
so
So see, only one team.
Right. Okay, so let's begin with the demonstration question then.
Okay, oh my God. Okay, so first question and the demonstration question and a clue, please, Chris Master.
Name this place.
And the
The
first clue?
first clue is Europe.
All right, so all the teams, if you wish to give an answer, you have 15 seconds to press the button. And the time starts now. CU1, you have 10
Okay.
seconds to give our answer. 1, and the time starts now.
Switzerland.
Switzerland. So judges, is it correct? It's incorrect, okay?
All right, so all teams, once again, if you wish to challenge, you have 15 seconds to press the button. The time starts now.
Okay.
NMU1, you have 10 seconds to say your answer, and the time starts now.
Slovakia.
Slovakia. Okay. Judges, is it correct? No, it's incorrect.
So as you can see, this is a game of speed, so you really have to be quick in this. And since two teams have answered wrongly, the next clue, please.
The Great Britain.
All right, okay. 15 seconds to press the button if you wish to give an answer. The time starts now.
15 seconds.
Being cautious, huh? Time's up and no team has pressed the button. So, the third clue, please.
135 meters tall.
All right, in 15 seconds, if you wish to press the button, please do so, and the time starts now.
Okay,
UPCM 2019, you have 10 seconds to say your answer. The time starts now.
The Big Ben.
The Big Ben. Okay, judges, is it correct? It's incorrect. Wow. Wait. Before going anything further than this, one thing that I beg from all of you guys that do not put your hand on the button before TK signal, okay?
All right, so hands
lay
away
it-
from the button. Okay,
That's
another
right.
chance to challenge. Your 15 seconds starts now. CU1, you have 10 seconds to say your answer. The time starts now.
The London Eyes.
London Eyes. Okay, judges, is it correct? for the actual question, you could be correct.
So the correct answer once again, please.
The London Eye.
All right.
Okay, so this is how we're going to play the hidden clues.
And after the solution has been given, we'll look at the rest of the clues that has not been revealed. So can we have a look at them, please? So there's the cantilevered observation wheel, and there's a picture of a Ferris wheel.
Yeah, exactly. Okay, so guys, let me remind you guys again that you do not put your hand over the box before TK signal, okay?
Yes.
Lay it beside yourself.
So
Great.
without further ado, let's begin with the first actual question.
A 25-year-old male presents to the emergency department after an episode of syncope while cooking dinner in the kitchen. He reports that he felt lightheaded for a second before collapsing. His mother witnessed the episode. She reports that he woke up about 10 seconds later and seemed to be fine. Consider the following clues and give the compatible diagnosis. The first clue is grasshopper.
All right, so all teams, if you wish to answer, you have 15 seconds to press the button. Your time starts now.
Oh, time's up. So the second clue right away.
The second clue, sticky rice.
All right, if the team wish to answer, you have 15 seconds to press the button. And the time starts now. CU1, you have 10 seconds to say your answer. Your time starts now.
Hypoglycemic periodic paralysis.
Oh, judges, is that correct? It's incorrect.
So not yet. All right, another challenge for all teams. You have 15 seconds once again to press the button. Your time starts now. CU1 decides to answer again. Okay, rest your answer in 10 seconds. Start now.
Brugada syndrome.
Judges, is it correct? It's correct! Congratulations! Wow! So CU1 now proceed to the diagnosis right away, right?
Indeed. In fact, it was very risky for them to press again right away because if they got it wrong, then they would have lose the right to answer that question.
Exactly. So meaning that they're so confident. Okay, CU1, so you can take a seat up there.
Yeah, so can we look at the
Okay.
correct answer once again, please?
Brugada syndrome.
And the rest
Okay.
of the clues, right?
Yes, the rest of the clues are...
So there's-
Provolpia serpentina, the chest X-ray result, and the special electrocardiogram lead configuration.
Oh my God.
I hope those are helpful in some
Okay,
way.
so right now only 2 places remain for the diagnosis, guys.
Right, so let's keep the dice rolling then, shall we?
Of course. So moving on to the next question. Question master?
From the following information, state the cause of respiratory distress. Clue number 1. Male preterm neonate, delivered at gestational age of 33 weeks.
All right, so all the teams, if you wish to answer, your 15 seconds to press the button starts now. NMU1, you have 10 seconds to say your answer. 10 seconds starts now.
Respiratory distress syndrome.
Okay, so judges, is that correct? Is that correct? Okay, they're taking some time. Oh, seems like some discussion up there for a while.
Right, please give our judges some time.
Okay. So, the judges? Microphone of the judges. Okay.
Your answer is incorrect, but please be informed that we asked for the cause of respiratory distress. The cause of respiratory distress. We have
Oh.
already given that this patient has respiratory distress, okay?
I mean like the respiratory distress syndrome, not the symptom. I mean the respiratory distress syndrome, which the neonate, like the newborn, hasn't like produced the surfactant yet.
Could you give more specific cause of the respiratory distress syndrome in your
Lack
answer?
of surfactant.
Okay, correct.
Whoa, wait. So, okay, so this team seems like they want to challenge or something.
Is everything all right up there? Would you like to speak anything?
Okay, IMC man. Help them with the microphone, please. Okay.
We just think that there was already a problem with the question and the answer, and there's a conflict, so that should be voided instead.
Judges, anything to say about that?
They were allowed to answer twice, and the other teams were not given the opportunity to buzz for the second try of the other team.
Ah.
Actually, I just like explained my answer.
Wow, it's challenging on the stage right now.
Regardless, the decision will be made by the judge, so don't worry, all right? So judges, if we would like to take some time to discuss about this and give us a solution.
Okay, so in the first place, the answer was not specific enough, but then I give that team more information, so I helped them. So we would like to nullify this.
Okay. So right now, all the teams will have another chance, all right?
That's right. Wait, but before that, one thing that I beg everyone is that when TK starts to about to count the time, if any team want to answer, please raise your hand, like in front of your head, together. Okay, because I found some of the team actually place their hand on the table so that it's not really fair for the other team.
So in a way, like before every question begins, so put your hand here so that the hands will be far away from the button, right?
That's right. Okay, guys.
All right.
We understand the same, right?
So
if
that
you
would
don't
be,
understand, you can ask your IMC man right now. Okay.
Yeah, so that would be more fair to all teams, okay?
Exactly. Okay. So, moving on.
To the next question.
That's right. Not okay. We're going back. Sorry.
No, before for the next question, without any question or argument for anyone, the first answer should be correct.
Mm-hmm.
Okay.
I mean, we will not ask you for more specific explanation. If it's not specific, not specific enough, we will
that.
judge that it's incorrect. Okay.
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 So that will be from the next question onwards. All right.
So, real hands ready? Okay. So, moving back to the previous question, right?
No, next question.
Next or moving back? Next. Okay. So, moving on to the next question. Question master?
Name a protein in ventricular cardiomyocytes with the following properties. The first clue, it does not directly transport ions.
All right, all teams, hands behind your ears.
Your hands, come on, your hands. Okay.
All right, hands behind your ears, and 15 seconds if you wish to press the button. The time starts now.
Okay.
UPCM 2019, you have 10 seconds to say your answer right now.
Phospholamban.
Judges?
Correct.
Oh, congratulations! UBCM 2019 make it to diagnosis.
And that will be like right at the first clue, so that's really, really good.
Wow, so fast. Oh my God, good job. So right now, only MET-TU and NMU1 are remain.
Right, so we will have one more question to go, right?
That's right, exactly. Okay, so the correct answer of this one is?
Phospholamban.
And the remaining clues are?
It is not a part of the myofilaments. It is phosphorylated upon the beta-1 adrenergic stimulation. Phosphorylation of this protein results in positive lucitropic effect. It inhibits sarcoplasmic endoplasmic reticulum calcium ATPase or SERCA.
All right, so thank you very much, Question Master, for the question and all the clues.
Okay, so only 2 team remains, but 1 place for diagnosis.
Yes, one last place. So who could it be?
Of course. Okay, so next question, please.
Consider a case of a 65 years old female with the following information and state the pathophysiological mechanism of her clinical symptoms and signs. The first clue is abdominal cramping and chronic watery diarrhea for 3 months.
All right, so put your hands like this again, and 15 seconds to press the button starts now. NMU1, your 10 seconds to answer starts now.
Activation of cyclic AMP.
Judges, is the answer correct?
Incorrect.
So it's still not correct.
Okay, so 1 more chance.
Yes, so one more chance for both teams. 15 seconds starts now.
Oh, seems like no teams. Okay, so second clue, please.
CT scan hepatomegaly and multiple hypervascular lesions within the liver.
All right, same thing once again. 15 seconds to press the button. Starts now.
Come on, guys. 1 place only. Time's up again. So moving on to the third clue, sorry.
And the third clue is the diagram, as you can see on the screen. Right.
Okay.
So 15 seconds to press the button if you wish to answer. 15 seconds starts now.
Come on, 1 place remains. Time's up. So fourth clue is
Episodic cyanotic flushing.
Okay. 15 seconds once again if you wish to press the button. And the time starts now. Oh dear, so looks like we're left with 1 more clue.
Okay, so in order to not wasting time, the last clue is
Increased urine 5-hydroxyindoacetic acid.
Alright, 15 seconds to press the button. Starts now. NMU1, 10 seconds to say your answer right now.
Activation of chloride channel.
Okay, judges? It's
Incorrect.
Incorrect.
okay.
So since team NMU1 answered wrongly twice for this question, they have lost the right to answer. But MET-TU, you still have the chance to challenge if you wish to answer. And the time starts now. It's all up to you now.
Come on.
Alright, your 10 seconds to say out your answer starts now.
At the microphone. Okay.
High calcium in cell. High intracellular calcium.
Okay, judges.
Incorrect.
So no team got it correct for this question, and this question thus cannot determine the final winner.
That's right. So however, it seems like we still have to move on to another question anyway.
Yes, we have a sudden death question for this round.
Yes? Okay.
But before that, let's review the answer for this question first.
Oh, that's right. Actually, sudden death question is played like the hidden clues.
Yeah, so technically it's like the fifth question.
Okay, so the answer is
Serotonin overproduction and niacin deficiency.
and the remaining clue is actually nothing because we review all the clues already.
Alright, so we hope that the last question will really help us decide the final contestant for the final game.
Yes, but if in case that it cannot, so MCQ scores we'll have to summon again.
Yes, so we have our staff ready. Anyway, let's begin then.
Okay, so the last question is...
A 16-year-old girl who has a long history of poorly uncontrolled rheumatoid arthritis comes for a follow-up at the outpatient department. Urinalysis shows proteinuria. Consider the following information and give the diagnosis. Clue number 1. The disease is associated with chronic inflammatory process.
All right, so 15 seconds to press the button if you wish to give an answer. Starts now.
Okay.
Met to you. You have 10 seconds to say your answer right now.
Nephritic syndrome.
Judges?
Incorrect.
Incorrect.
All right, so one more chance to challenge by both teams. The time starts now.
Okay.
You have 10 seconds to answer NMU1. The time starts now.
Membranonephropathy.
Judges?
Incorrect.
Oh, still incorrect.
So
Guys,
both teams answered wrongly once.
guys, your hands again, your hands. Yes. Okay, thank you so much.
So moving on to the next clue.
Second clue. Production of a causative protein by hepatocytes is regulated by interleukin-1, interleukin-6, and tumor necrotic factor alpha.
All right, hands behind your ears and 15 seconds to press the button. Starts now. NMU1, 10 seconds to say your answer right now.
Membranoproliferative glomerulonephritis.
Judges?
Incorrect.
Oh, still incorrect. Oh my God.
So Met to you will have the only chance to press the button from now on.
Okay.
So if they would like to challenge for this same clue, you have 15 seconds to do so right now.
Come on, guys. Time's up.
Right, they're trying to play safe for now.
Yeah, of course. Okay, so next, the third clue.
The causative protein is inappropriately cleaved, misfolded, and becomes insoluble.
Okay, so if Met to you would like to answer, you have 15 seconds to press the button. The time starts now.
Let's see whether they will wait until the fifth clue or not. I wouldn't. Time's up again.
So next clue, right?
Yes, so the fourth clue is...
The renal biopsy with Congo red stain with and without polarization as displayed.
All right, once again, if you wish to give an answer, you have 15 seconds to press the button. The time starts now.
Okay, so anyway, we're moving on to the fifth clue.
We're down to the last one, right?
That's right. Okay, so the fifth clue is...
Similar to the kidney previously shown, deposition of the abnormal fibrillar protein can also be found in many other organs.
All right, this is your last chance to answer now, Met to you. So 15 seconds to press the button. Starts now.
Okay.
You have 10 seconds to answer.
Diffuse proliferative glomerulonephritis.
Judges?
Incorrect.
Wow, so no team got it correct in the hidden clues and also sudden death.
And once again, we're down to the MCQ score.
That's right. Okay, so MCQ score, please.
In the meanwhile, can we have the correct answer for this question as well?
Oh.
Amyloidosis.
Okay, so right now MCQ score is in TK hand.
All right, I need you to help me hold the mic.
Okay, so the team that will qualify to be in the diagnosis is...
Met to you.
Okay, congratulations from Matthew. However, please give a big round of applause for NMU1. Okay,
You
thank
guys
you
did very
so
well.
much. Yeah, thank you so much. Okay, however, we're going to begin with the diagnosis right now.
So no breaks at all. So we're gonna jump right into the action.
That's right. Okay, so for the diagnosis, as I told you before, that we're trying so hard to make the contestants feel like they are the doctors.
Yes, but there's a lot of at stake for this game because this game will determine who is the final winner of CMU-IMC 2019.
Exactly. Okay, so are you guys ready to see the final winner?
Come on, you're better than that. Are you guys ready? Much
Great
better.
job. Okay. So next, again, we would like to play the video about the rules of the diagnosis.
Yes, things can get quite complicated here.
Of course. Okay, so enjoy, guys.
Diagnosis. At the beginning of the game, each team will receive 2,000 points. There will be 5 bonus questions for each team to gain more points, which can be used later for more advantages. There are 2 case scenarios in diagnosis. Both consist of the patient's history and physical examination. After that, a pool of laboratory results or images with different prices will be shown. Every team can decide whether to exchange for them using the points that were previously earned. An exchange is done by writing down on a paper and placing it in the capture box within 90 seconds after a signal from the host. After receiving the results, all the teams will be given 120 seconds to answer the question. If the team makes the correct diagnosis, 2,000 points will be given and any amount of points spent earlier will be returned. In contrast, no points will be returned to the team who gave an incorrect answer. The team with the highest rank in this round will be the winner of CMU-IMC 2019.
Yes, but before we begin, allow me to explain the rules once again.
Yes.
So, every team will start with 2,000 points and all the teams can actually earn more points from 5 bonus questions before the actual case scenario questions. And these points will come in handy much later. So how do you do the bonus question is pretty much a semi-final round question scheme where you just answer, place in the capture box, and yeah, that's pretty much it. And there will be 2 case scenarios with laboratory results shown on the screen that will help you in the diagnosis. And once the pool of lab results is shown, you will have 90 seconds to decide how many points you will use to exchange for what items, for what lab results. I'm sorry. Yep, and after the 90 seconds, the staff will bring the lab results or images to the teams respectively, and you will have 120 seconds to make a diagnosis for the question. And as the condition is mentioned in the video that if you get the answer correct, not only you get your points back, but you also get 2,000 additional points. But if your answer is wrong, then you will not get any points back at all. So the winner will be decided by the amount of points left at the end of this game.
Exactly, and moreover is that because actually for this round, I would say, we have the demonstration question. So actually we will play the demonstration question first, and then followed by the real bonus question, and then after that, the real diagnosis.
Yes, so if the team is ready, but IMC man, please raise your hand. Or if you would like to ask any question, feel free to do so right now.
But before that, TK, do you have anything that you think it is important for the contestant to know before we're going to play?
Oh, and what is that?
Oh, I asked you.
Oh, wait, why did you
I
ask
didn't
me?
let you ask me, I asked you.
Okay, let's see, let me think about, okay, the rules have been set.
Yes.
Any like special conditions or something?
Maybe, do you have anything to say?
Well, I believe, is it because that for case scenario question it's complicated, the judges allow abbreviations?
Ah, that's right, guys. Judges allowed abbreviation in this case because the question is very, 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 and very long.
Oh, keep in mind, this is only the case scenario questions, not the bonus questions. So for the bonus questions, do write your answer in full.
That's right. Your bonus question will be so normal and like the semi-final round as usual. And actually, for this question, because it's quite long, so meaning that they got more time, which is 2 minutes, right?
Yes, like 120 seconds, 2 minutes, exactly.
And actually, moreover is that because you guys will have to spend some more time calculating your laboratory polls. So please be prepared and maybe set some strategy or tactics with your friends.
Oh yes, a clear warning would be that you're not allowed to use more points than the allocated budget you have in the beginning. So if you only got 2,000 points, don't use 2,500. That is not allowed.
Exactly, and moreover, if you guys really need the extra paper, you can tell your IMC man, they would get it for you.
Right.
Okay.
So that's about it, I suppose, except that to exchange for lab results, you simply have to write down on a paper and place it into the capture box once again.
That's right. And for the lab pool, write just only the number of the lab that you choose. You don't have to write the whole sentence.
Right, I know this is a lot of information going into your head at the same time, so if you have any questions, feel free to ask your IMC man.
That's right. You can ask your IMC man right now or whenever you want before the real question will begin.
If no additional question, IMC man, please raise your hand.
Okay. So any team you have any question, ask them right now. And if you have nothing, IMC man, raise your hand. Okay. So you are finished already? The other team, take your time. It's okay.
Yes,
Okay.
it's important to get it right?
Take your time, guys. It's quite a long question, actually, because it seems like you play the semi-final round together with the diagnosis.
Yes, it's like 2 games in one in a sense. All right, looks like all the teams are ready.
Okay, so we will start with the demonstration question of the diagnosis in order to let you guys understand how to use stuff or lab result or other thing in that.
Yes, let's bring over to the question master.
Okay, question master, please. But before that, this is the demonstration question.
And the theme is MCU or Marvel Cinematic Universe.
Okay, with the time.
Well, you have 45 seconds to request for lab results and you have 60 seconds to answer and the points will be 2,000.
Okay, so the demonstration question is
Who is he or she in MCU Marvel Cinematic Universe?
All right, can we have a look at the lab results, please?
Okay, so
question master, can you read all the lab results for us, please?
Okay. Gender, 500 points. Job, 1,000 points. Talent, 500 points. Dressing, 1,000 points. Picture, 1,500 points.
All right.
Okay, because this is a demo question for real, our question master will not read out the lab results.
Oh, right, I'm sorry.
Okay, so TK?
So within 45 seconds?
That's right.
All right, 45 seconds to choose your lab results by writing on the paper and placing it in the capture box. The time starts now. Time's
up. So let's look at the lab result that each team choose. Okay, so on my side, UPCM 2019 choose what, TK?
We've got talent and picture.
Okay, and for CU1, they choose picture and talent. While the other team,
Is it on the screen? No, it's not on the screen.
it's not on the screen. So, any claims for this? Nothing. Okay. So,
Okay.
okay, so meaning you don't want any lab result, right?
You're gonna go with gut feeling, huh? Anyway, staff, please bring the lab results anyway.
Okay, so waiting for our staff to bring the lab result down. Okay. After IMC man receive the lab result, please raise it up high. Do not give it to the contestant yet. Okay.
There's like what, over 50 characters in the MCU, so good luck with that.
I guess maybe Betty, you really want to challenge it.
Yeah.
Okay, so TK.
Right. For this demonstration question, you have 60 seconds to answer. The time starts now.
Time's up.
Let's have a look at the answers then.
Okay, so the answer of CU1 is Captain America.
Met to you, Gwen with Iron Man.
Okay.
And also UPCM 2019 went with Captain America bracket Steve Rogers. Wow, very detailed.
Okay, so is the correct answer ready? Okay, so the correct answer.
Wait, we have to review the clues, right? Or the lab results before we show the full answer. Yeah, they would love to know.
No, it's after. It's after the correct answer is reviewed, okay?
Oh, okay, sorry about that.
Okay, so the correct answer is...
Captain America.
Okay, Matthew, it's okay, guys. It's okay, guys.
It's basically like throwing a dart into a pool of fish, I suppose.
Okay, so about the other lab results for the demonstration question, it's not reviewed.
Oh.
Okay. No, not with any question.
Yes, UPCM 2019. Microphone is all right?
Hello.
Okay.
Can IMC man open the envelope before give to the contestant?
Because
it's hard to open.
Okay, the judges, would you agree with that?
The real one will not be sealed. Okay?
So
it
only
will
for
not
this
be
one.
sealed.
Right, it's just in the envelope. Okay. So, are you all right with that answer? Okay, so moving on to the first bonus question then.
Okay, so this is just a demo question, so everything will set 0 again.
So every team back to 2,000 points.
Okay, so next will be the bonus question for in order to increase the points.
Yes, so for the 5 bonus question in total you can possibly get 2,000 points. So the maximum points you can have right now is actually 4,000 points.
Okay, so let's begin with the first bonus question. So the level is
Intermediate.
And you got
30 seconds.
with the points
250.
Okay, so question master, the bonus question is
Protanopia is caused by a defect of which specific retinal cell type?
All right, thank you, question master. So, teams, you have 30 seconds to answer this question. 30 seconds starts now.
Nine, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, time's up. So let's look at the answer.
Yes, we shall.
Okay, for CU1, they answer red. What? TK, can you read it
Red
for
cone
me?
cell.
Okay, and the other two.
So on my screen, UPCM 2019 with long wavelength retinal cone cell and METU also with cone cell.
Okay, so a bit actually slight different between the team.
Yes, a little bit, but yeah,
But
we'll
still
find. We have
yeah.
to see.
Still have to depend on our judges anyway. So the correct answer of the first bonus question is
Red cone cell.
wow. So congratulations to team. Well, CU1 of course.
Yes, and UPCM 2019 actually got the answer accepted, but the answers by METU is not allowed for this question.
That's right. So be more specific, I guess. Okay, so the scoreboard right now. Both UPCM 2019 and CU1 got 2,250.
Yes, so don't worry, there's 2 more questions to go and you can get more points anyway.
Okay, so moving on to the second bonus question. Title. Okay,
Nothing.
level.
Intermediate.
You got
Another 30 seconds.
with the points.
250.
Okay, so question master, the full question please.
Perfusion through the left coronary artery occurs at the maximal flow rate during which specific phase of the cardiac cycle?
All right, so your 30 seconds to answer this question will start now.
N, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, time's up. So the answers are
So we've got ventricular diastolic phase from CU1.
and from TU the answer ventricle something something.
Filling, I suppose.
And for UPCM 2019, anything to claims? Nothing. Anything to claims?
They did not insert on time.
Okay, so still the judges still a bit talking about the answers, so it might take some more time. So actually next time I suggest that maybe 5 or 10 seconds before the time is up, please insert the paper into the capture box.
Right, make it automatic.
That's right, so that you will not lose your scores or your points, I would say. So actually, the answer is ready now. So the correct answer of this bonus question is
Isovolumic ventricular relaxation.
wow. So no team got it correct from this bonus question.
Well, that's unfortunate. However, still all teams just have 3 more questions to go.
That's right. Okay, so the scoreboard remained quite the same.
Yep, so let's move on then, shall we?
Of course. So the question title is
Nothing once again.
level
Advanced.
and time
It's now 60 seconds.
with the point.
500.
Okay, so be prepared, guys. So the full question is
After an episode of high-frequency pacing, a cardiac Purkinje fiber exhibits a sustained hyperpolarization state as depicted below. State the name of this phenomenon. For 250 points, and the name of the transport protein that mediates the hypopolarizing current in this situation.
Oh, so it's split into two small questions for this question. All right, so you have 60 seconds to write your answer and place it into the capture box. Your 60 seconds starts now.
Ten, nine, eight, seven, six, five, four, three, two, one.
Okay, time's up. And the answer, please.
So it appears that we have, for CU1, the first part they answered compensatory pause and something in the middle, but two they've answered potassium channel.
Okay, and for UPCM 2019, I'm not sure about the first answer, but the second is inward potassium channel. And for MedTU, they answer only the second question, which is potassium ATP channel.
All right, looks like the judges are ready.
Okay, so the correct answer of the third bonus question is
Overdrive suppression and sodium potassium ATPase.
Wow, the bonus question, but no one got the bonus.
Right, for the second time, I suppose.
Oh my god, what is this?
Well, that means that the teams will have the similar amount of points for the next few questions. But don't worry, there's still like
Two?
two more.
Yes.
All right, we can still keep this going. All right.
Okay, so I really want to see the fourth bonus points and how much could it cost. Okay, so the fourth bonus question.
And it's advanced once again.
With a time,
60 seconds.
and you will get.
500 points.
Okay, so question master, the fourth question is.
A 60-year-old male patient undergoes a pulmonary function test. His flow volume relationship during maximal inspiratory and expiratory efforts, displayed in black line, is shown below. Normal flow volume relationship, as dotted in gray line, obtained from a healthy individual, has been included for comparison. A tidal flow volume loop is also recorded at rest, at display in blue line. Then, the patient performs exercise using an ergometer, which gradually changes his tidal flow volume loop from blue to the red line.
All right, so we like to read the last two parts.
Name the phenomenon that is responsible for the gradual change of the tidal flow volume relationship from the blue loop as in resting state to the red loop during exercise for 250 points. And according to the given result, how would the patient's lung compliance be functionally altered by strenuous exercise? Answered in decreased, increased, or unchanged for another 250 points.
All right, thank you, the question master. I apologize for the interruption just now. So, 60 seconds to answer this question. Once again, the time starts now.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Time's up.
up. Okay, so the answers are. Okay.
Let me look at this. So CU1 answered with repetitive muscle stimulation, and for the second question answered with increased.
While UPCM 2019 first answer air trapping and second answer increased, but MET-TU answer dynamic compliance alteration and decreased.
Yes, so if the judges are ready, you can give us a signal right away.
Okay, but however, this question is so long that I
Yes.
thought it was the real one.
Yes.
It is the bonus that I'm not sure whether it will give bonus to anyone or not.
Hopefully the case scenario is not too long like this.
Who knows? But don't forget that it is the question that will find out the winner, so might be more difficult than this.
So,
Okay, so the first team, UPCM, you got air trapping correct, but the second one, increase, is incorrect, so you got 250 points.
So it'll be
MET-TU.
blinking lights.
Okay,
Okay.
okay, turn green and red, and
Okay.
Doctor,
Okay,
this is
okay.
done manually,
Then-
so you have to move on.
then for MET-TU, you get decreased, right? So the second answer is correct, but the first one is incorrect.
So
Okay,
another
so
blinking
blue
light.
green.
250
So red
points.
green again.
And for this one, please.
The team CU1, sorry, both of the answers are incorrect.
Oh, okay. So only two teams that will earn 250 points. Okay, so stop.
IT department.
Keep doing red and green.
Anyway, please review the full answer again.
Okay, so it's so long. Oh my god. Okay, so meaning that the correct answer of this is
Dynamic hyperinflation and decreased.
Yes, so
Oh.
basically UPCM 2019 and MET-TU will each get 250 points. IT department, please stop blinking anyway, it's very distracting.
okay. So in this case, we in UPCM 2019 right now in the first spot with 2,500 points.
All right, so we have one more question, right?
That's right. Last bonus question, guys. Try to get more points from this. Okay. So, how much will it cost for the last question?
So the last question is also 500 points.
Okay. The level is.
Advanced.
And you got.
60 seconds once again.
Okay. So the last question is.
A 15-year-old boy presented with cyanosis detected during a health screen at the school. He also had a history of mild dyspnea on exertion since birth, which has been gradually resolved as he grows up. Pertinent physical examination. Body temperature 37 degrees Celsius. Heart rate 120 per minute. Respiratory rate 22 per minute. Blood pressure 120 over 70 millimeter of mercury. Oxygen saturation room air 94%. Heart, regular rhythm, loud P2, point of maximal impulse at the left 6 intercostal space and anterior to the mid-axillary line. Right ventricular and left ventricular heaving without thrill. Electrocardiogram, normal sinus rhythm with combined ventricular hypertrophy. Chest X-ray cardiomegaly. Cardiothoracic ratio 0.57. Increased pulmonary blood flow. Enlarged pulmonary trunk with rapid tapering of pulmonary artery branches. CT angiogram and cardiac catheterization, pulmonary artery pressure 60 millimeter of mercury. Questions 1. What is the mechanism of cyanosis in this patient? Question number 2. What is the diagnosis?
All right, so for the last bonus question, you have 60 seconds to answer, and the time starts now.
9, 8, 7, 6, 5, 4, 3, 2, 1.
Time's up. And the answer of the last bonus question are...
Let's have a look. So look at that. So we have decreased pulmonary blood flow for the first question, and for the second question by CU1 is VSD, I suppose.
Oh, okay, and on my side, the first question, UPCM 2019 and METU answer the same thing, which is right to left shunt, while UPCM answer the second question as the tetralogy of Fallot. Okay.
Yep.
So some of the team managed to get both of the answers, but some not.
We have to
Okay.
wait for the judges to say anything.
Okay, so
Once
the
again.
UPCM and METU both get 250 points for the first answer, right to left shunt. But CU1, again, sorry, both answers are incorrect.
All right, so for the left side, there'll be blinkings again, and for this side, it'll be red, right?
Okay. So the correct answer, okay, they keep linked, CU2 instead. Okay, so the answer of this bonus question is?
Right to left shunt and aortopulmonary window with pulmonary hypertension.
Right,
Wow.
so those will be all for the bonus questions,
points.
right?
Okay, in order to clarify what is going on again, okay, so before we're going to start with the actual diagnosis question, what is going on is that, okay, you guys will get 90 seconds, right?
Yes.
To choose the lab pool, and then 120 seconds to answer.
Yes, to make the actual diagnosis.
That's right, and then after that, you guys, the lab pool will be all reviewed for the audience, okay? And then after that will be the correct answer.
Yes.
Okay, so seems like right now UPCM 2019 got the highest points.
Yes, followed by METU and CU1.
Okay, so please use your points wisely in choosing the lab results.
Yes, these will come in handy, and these will determine the final winner of CMU-IMC 2019.
That's right. Okay, in order to not wasting time anymore, let's move to the first actual question of the diagnosis.
All right, let's begin.
Okay, so case number 1, the time?
Well, requesting, as I've said, is 90 seconds, and answering will take 120 seconds.
If you got it correct,
You will get the points from the lab results back, and you will also get 2,000 points.
okay, so the first diagnosis question is...
A 46-year-old female patient seeks medical advice at the outpatient department. For the past 2 months, she reports having recurrent episodes of racing heartbeats and almost passing out. These episodes typically coincide with increased physical effort. She denies any history of chest pain, dyspnea, or edema. Physical examination as follows: head, ear, eyes, nose, and throat. No palconjunctivae, no icteric sclerae, no jugular vein engorgement. Heart, the heart rate of 18 beats per minute. Regular rhythm, no parasternal or apical heaving, no thrill. Normal S1 and S2 sounds, no murmur. Lungs, normal chest expansion, normal breath sounds bilaterally. All the findings are unremarkable. Just after the physical examination, the patient experiences a sudden brief episode of palpitations and lightheadedness. Further investigations are then carried out.
So, can we have the pool of lab results, please?
Available information: blood chemistry, complete blood count, chest radiography, the posterior anterior view, electrocardiogram during palpitation, electrocardiogram without palpitation, echocardiogram, and the cardiac MRI.
So all the lab results with different points are already displayed on the screen. You have 90 seconds to decide whether to use how many points and what will be the lab results you wish to exchange. Your 90 seconds starts now.
2, 1.
Time's up. Okay, so the lab result that each team chooses.
So on that side, PCM 2019 selected blood chemistry, complete blood count, and ECG during palpitation, while MedTU chose blood chemistry and complete blood count.
While CU1 TK.
They're both ECGs during and without palpitations.
Okay, so right now our staff is preparing with the lab results, and the lab result will be arrived for our contestants later on.
Yes, so I believe at this point in time, everyone is very restless right now. It's been a long day, isn't it?
That's right, me too, actually. I saw some of the GM was like, they was dead already.
Let's ruin the GMs for a little bit.
I know that today is such a long day, guys, but come on, you need to be with me.
There's one more right in front here.
Okay? JJ, you need to be with me. Come on, wake up.
All right, a little bit lighthearted moment for all of us.
Okay,
So the staff, please bring the lab results for all the teams, please.
It's okay. I know that you're so tired. You can sleep. I'm just kidding.
Right, just having fun because I myself am also a little bit sleepy. So, it appears to be that I have some little drop in energy just now. So, I'm back up again.
That's right. Okay. In case you guys may was like, why did I mention him? Because we're close, actually. Okay. So the lab results still taking some more time until it arrives. Actually, only Team UPCM 2019 choose 3 lab results.
Yes.
Because they have the highest amount of points.
Yes, so basically having the most point at the beginning would certainly be a huge advantage.
But it will be like a higher chance for all of you guys if you got this question correct.
Yes, so it's good to get the answer right and use as many points as you can, but also reserve some for the next case scenario as well.
Exactly. So it's actually, as I told you before, it depends on your strategy about how to manage the points that you have for each lab results.
Yes, this game is very tactical, I would say.
Yeah, and as I told you that in real life, because we're all going to be the doctors, so I think requesting for the lab result is what you have to do one day.
Yeah, I suppose like patients come in, have their physical examination done, and oh look, what do we need? What kind of lab results do we need? But because this is a game, that's why we add a little gimmick that there's points at stake as well.
Indeed, we try to make this even more excited. Okay, so seems like the lab result is arrived. So IMC man, okay?
Alright, so audience, don't worry, you will get to see those hidden results later. But for now, all teams will have 120 seconds to make the diagnosis. And the time starts now.
6, 5, 4, 3, 2, 1.
Time's up. So the answers of each teams are. Oh, what's going on with Matthew?
Matthew.
Okay.
Oh,
so
okay.
nothing.
So UPCM 2019 with ventricular tachycardia, right?
And for CU1.
CU1 answer with WPW syndrome with episodic AURT or AVRT.
Well, what?
Is AURT or AVRT?
Depends on our judges.
Yes.
If in case that they cannot read it clearly, then they will request to pay for it out there.
Yes, sure.
Okay, so the answer are different, I guess.
Yep.
So in this case, that means one team or no team will
Or
be
both.
correct. Yeah. Oh.
Anything can happen.
Okay, so actually next we will about to review because I know that the audience might be what is going on out there. I can't see the lab results. So we're going to show all the lab results that.
Excuse me, please.
Yes.
Today we have a guest. We have Dr. Rangsalit Kanchanawanit from Department of Internal Medicine. He is a cardiologist. He would like to explain for the audience.
Oh, that would be an honor. sir.
Great! Oh my God.
Please welcome Dr. Rangsalit as well.
All right. Shall we show the ECGs first? Okay. So this ECG shows a very, it's a wide QS complex tachycardia. It's, well, you can't really see it. It's that there are any AV dissociation, but look at the morphology. It's actually, it's compatible with ventricular tachycardia. But you, after you able to tell it's VT, you need to be able to tell where it's come from. The morphology of the ECGs is left bundle branch morphology, means that it originates from the right ventricle. The axis is, you see that the in leads 2, 3 in AVF, it's a positive, so it means it's inferior axis. It's coming somewhere from the, the outflow tracts of the right ventricle. So the differential could be probably two things. It could be a disease from the RVOT that produce an ectopic called RVOT-VT. The other differential diagnosis would be arrhythmogenic right ventricular cardiomyopathies of dysplasia. So we need to look at other things to distinguish between these two. Resting ECG might be a clue. Can we show the resting ECG? Okay, this resting ECG is very interesting. You can see that in V1 there is a small wave after QS complex. This is called an epsilon wave, which means there is an after depolarization. So this is a trigger that also there are repolarization abnormalities there too. So these actually quite pathognomonic of arrhythmogenic RV dysplasia or RV cardiomyopathy. We might have to confirm with the echo and MRI. Could we show that? So the echo, this is the right ventricle, which is dilated and poorly contracts, and there is a sacculation of the walls. This is a typical of the ARVD morphology. Can we see the MRI, please? Okay, the MRI shows that the RV is dilated, poorly contracts, and you can see that the walls is actually very thin, and the muscle is replaced by the fatty tissue. If there is a, do we have the sequence that show the fibrosis? That there aren't. Anyway, a typical one you will see the fibrosis of fatty infiltrate of the right ventricular wall. So that's this is very typical case of arrhythmogenic RV dysplasia or RV cardiomyopathy.
So thank you so much, Dr. Rangsalit.
Okay, thank you so much. Okay, so that is all about the lab results, right? Okay, so next, the correct answer of case 1 of the diagnosis is
Arrhythmogenic right ventricular cardiomyopathy or arrhythmogenic right ventricular dysplasia.
okay. So seems like no team got any answer correct.
Yes, so the points will be removed and not returned for this question. But there's still one more question to go.
Exactly, you still have one more question to go. So right now, Meti, you have the highest amount of points remain.
Right. And followed by UPCN 2019 and CU1 respectively.
Exactly, okay. So on the stage, are you guys ready to move on to the next question?
Yes.
Wait. The staff? Okay, wait for some fixing for a while.
Staff, is everything all right?
Okay, waiting for a while to fix some technical problems occurring up there. Okay, so actually it for the previous question.
Yep.
Oh, it's actually our honor to get so many things from Ajahn Raksarit in this
Yes,
case.
it's a really good insight for all of us. And anyway, mathematically speaking, just now with the scoreboard, actually any team can still win at this point.
That's right. It depends on your strategy on using your points and the lab results. Okay, so seems like everything is all right, staff. Everything is great.
Staff.
Okay,
Perfect.
staff confirmed. Okay, so for the title of this second diagnosis question is, it's case number 2 with the time.
So once again, 90 seconds to request for lab results, and you have to answer within 120 seconds.
And the points?
2,000 if you get it correct, plus the additional points returned.
Okay, so the real question is,
A 7-year-old boy studying in grade 2 with average learning performance has had progressive snoring since the age of 4 years old. An adenotonsillectomy has been done, but the symptom persists. He also feels sleepy all day and is short of breath during exercise. Information from the Child Health Supervision Clinic shows rapid increase in his body weight, 10 kilograms in 1 year. He comes to the outpatient department today because of abnormal findings in the chest x-ray, taken at a health checkup unit. Physical examination, vital signs, body temperature 36.8 degrees Celsius, pulse rate 106 per minute, respiratory rate 20 per minute, blood pressure 100 over 56 millimeter of mercury. General appearance, truncal obesity without acanthosis nigricans, body weight 54 kilograms, height 132 centimeters, body mass index 31 kilograms per cubic centimeters, head, eye, ear, nose, throat, no tonsil removed, mild swelling of inferior turbinates, lungs, good air entry, normal breath sounds bilaterally, heart, normal S1 and S2 heart sounds, no loud P2, no murmur. Abdomen, fatty abdominal contour. Liver and spleen cannot be palpated. Extremities, no clubbing of fingers.
All right, so can we have a look at the pool of lab results, please?
Thyroid function test, lateral cervical soft tissue radiography, pulmonary function test, computed tomography of the chest with contrast, polysomnography.
All right, so before we begin, would you like to anything?
yes, before that, because as you can see,
These are the lab result that has been already mentioned in the history, right? He came to the clinic because of abnormal chest x-ray. From health checkup, we provide them for free. And the growth curve is also displayed. And because of a minor technical error several minutes ago, the thyroid function test will be also provided for free. Okay?
Oh. So with that being said, all teams, have you received the pool of lab results where you know which option to choose? Yes? Okay. So all teams, you will have, so thyroid function test is given for free, right? Okay, so for the rest of them, you have 90 seconds once again to choose the lab results you would like to obtain. Your 90 seconds starts now.
Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, time's up. So please review.
Right, let's have a look at this.
Okay, so seems like from Matthew they choose thyroid function test.
Only, which is already given for free. And
That's
the same
right.
thing with UPCM 2019, right?
Yes?
And the rest will be lateral cervical soft tissue radiography and pulmonary function test.
While for CU1 they choose lateral cervical x-ray. And another thyroid function we give you already.
Yes, so in the meanwhile, staff, please prepare the lab results for our teams right up here.
That's right. This is the second question now, and it's going to tell us who will be the winner.
Yes, so this will be the final question. So, you know, you gotta keep your energy up.
Of course, and moreover is that I think you guys would look. They're so serious up there, but we're trying to make everything not too sleepy right now.
Yes, as much as we are stressed out right now, I'm trying my best to hold my composure.
Of course. Okay. So right now, after the lab result for the contestant is being prepared and delivered to the IMC man. Again, IMC man, please show it up high.
Yes, so in the meanwhile, our staff are still compiling all those data.
Yes. So actually, before apologize for our technical problems.
Yes.
Okay, but right now everything is come back normal, everyone.
Yeah, so rest assured, the game will still go on as per schedule.
Of course. Okay. So still waiting for the lab results. And actually, for me, I think the exercise is very hard.
Yes, I believe that I myself am so not prepared for this.
Okay, but I think seems like so many audience are actually enjoyed during the time that we have the diagnosis.
Right, right.
Because you could see how everything flows, how the lab results is actually look like.
Yes, and also the little explanation in the previous question that came out as a surprise to me as well.
That's right. And actually, it was like such a surprise. I was like, wow. I mean, our professor is up there, so it's surprising actually.
Yes.
Okay, INC man, great. Raise your hands up.
So one team is up, and
The second team and the third. Okay.
anytime now, anytime.
Okay, IMC man, raise your hand up with the files. Great. Okay, and actually one team with an iPad.
Two teams actually.
Two teams? Oh. Okay, so after 120 seconds, I think we will find out who will be the winner.
Yes.
Or
So
CMU-IMC this year.
yes, for the very last time, teams, you have 120 seconds to make a diagnosis. Your time starts now.
Ten, nine, 8, 7, 6, 5, 4, 3, 2, 1.
Time's up.
Wow, can't wait
let's-
to see.
Yeah, let's look at the last answers of CMU-IMC this year. Okay, so for UPCM 2019, they answer obesity, hypoventilation syndrome. While for MedTU, I cannot read it out clearly.
All right, from my side, CMU1 answered craniopharyngioma.
Okay, so next will be, we are going to review the lab pool that we got that actually the contestant have a chance to choose. Okay, this one is pulmonary function test.
Okay, good afternoon, everybody. Okay, let's see that the growth curve. Could you please show the growth curve? Okay, you can see this is a rapid onset of obesity after he was 2 years old, right? And this chest X-ray, you can see both is AP upright and lateral. You can see this, the obesity in the left side and in the posterior mediastinal compartment. And after next investigation, please. Okay, for the for CT chest, if you confirm the chest X-ray, you can see the posterior mediastinal mass is may suggest the ganglioneuroma. Okay, next investigations. Okay, if you ask for the polysomnography, that is the gold standard for diagnosis for this disease, you can see it's like efforts of abdomen and thorax. You can see the flat of the both abdominal and thorax when the CO2 increase, or this patient has a hypoventilation, but his thorax and abdomen is not respond to the hypoventilation. So for the polysomnography is interpret that central hypoventilation. Okay, and can you next the investigation, lateral neck soft tissue. Oh, okay. This show this patient was done the adenotonsillectomy. You can see just only the airway that is patent, and just soft tissue around the neck is maybe fatty. So for the pulmonary function test, you can see the FVC, FEV1, and FVEV1 above. FVC is FVC and FV1 is decreased, but FEV1 over FVC is normal, and he has the low total lung volume. It means that he is a restrictive lung disease. So all of this is thyroid function is low, right? That is means central hypothyroidism. This patient is diagnosed obesity hypoventilation syndrome. That is
Oh my God! Congratulations, UBCA 2019!
So let's have a look at the answer once again.
Wow, so the answer is, again, please. Okay, so the answer is
rapid onset obesity with hypothalamic dysregulation, hypoventilation, and autonomic dysregulation, or Rotha's syndrome.
This is very long.
Wow, okay, however, congratulations to UBCF 2019!
Can we have the scoreboard, please?
Okay, so the winner is UPCM, and the first runner-up is
Met TU with 2,100 points.
And the second runner-up is CU1.
All right.
Congratulations.
So give all them a warm round of applause.
Okay, so congratulations to you all up there, and also you guys up there.
Yes, indeed.
Okay, so it actually comes to the end of the stage round today right now.
Yes, exactly. Wow, I'm so relieved.
That's right. Oh my God. So I think at first there will be no winner in this case actually.
Fortunately, we have found one.
That's right. So UPCM, you did great. Okay. So actually, it comes to the end.
Yes. So we would like to invite the 3 teams to later select a book at the reception for your prize.
That's right. Okay, guys. So all 3 teams, please go to, after this, please go to the reception and select the book sponsored by
Elsevier.
That's right. Okay. So before we're going to end our stage round, actually, officially, I would say.
Yep, there's some announcements to be made.
That's right.
Yeah, basically, your GMs will have the QR code for the feedback form of this competition, CMU-IMC 2019. So all teams, you are able to access this form today and tomorrow. So please fill it all up so that you can help make CMU-IMC better next year and in the future. And 3 days later.
Okay, congratulations, guys.
Yes. So all members of the team must fill out this feedback form so that in 3 days later, our staff will email you or send you the MCQ scores in some way or another.
That's right. So don't forget to scan the QR code from your GM. Okay, and actually, CMU-IMC 2019 this year cannot be held without a kind sponsor. Okay, so the first one, Sipat Medical Center, Faculty of Medicine, Chiang Mai University.
And also thank you Elsevier for sponsoring this event as well.
Okay, and also A+ Light and Sound Systems.
And also, last but not least, Piatai 2 Hospital. Thank you so much for making this event possible.
That's right. Okay, but moreover, I think I consider them as the most important people in this competition.
And who would that be, Namfa?
Of course, all of you who are in here with us today.
So give a round of applause for yourselves. That will include all the participants, all the advisors, all the audience, as well as the GM, the staff members who help us, and also our judges.
That's right. Without all of you guys, CMU-IMC this year could not be end up so perfectly like this.
Yes, and along the way, if there's any blunders that we have made or any errors we have made along, so we apologize for any inconveniences as well.
That's right. We promise to make it better next year anyway.
Indeed.
Okay, and moreover, is as I told you guys before, that CMU-IMC doesn't aim just only for some of you guys to win the prize, but we wish you guys will get some experiences or some friendship back to home.
Yeah, so I hope that it's all enjoyable for all of you and also memorable at the same time.
That's right. Okay, so here comes to the end of the stage round.
So here we go.
Okay, so before that, I would like to announce one more thing, is that the closing ceremony will be start at 3:45. So please be back in the hall in 3:35, okay?
Yes, be early.
That's right. Next will be the break, and you can grab your snack box downstairs again, and please be back in this hall at 3:35.
Yep, so once again.
Okay, it's come to the end, so ขอบคุณค่ะ